the unpredictability of being human is part of what makes surgery so much fun. I always say surgery is like Christmas. You never know exactly what you're going to get until you get in there. And then knowing what to do and figuring that out once you're in there is the joy and the art of being a surgeon. I really love that part. Well, hey there. Welcome back to the Dr. Crockett Show. I'm your host, Dr. Susan Crockett. I'm a minimally invasive GYN surgeon in San Antonio, Texas. And today I've got a very special edition for you of the Dr. Crockett Show. We are coming up on the 10th anniversary of Virtuosa GYN, which is the practice I founded 10 years ago, dedicated to making surgery easier for women. That's what we do. That's what we do here. And so for today's episode, I thought I would answer a lot of your questions about what's this MIGS thing that you keep calling yourself? What is a MIGS? Is that like the Russian MIGS in Top Gun Maverick? Well, no, it stands for minimally invasive GYN surgeon. That's what I am. And today's episode is all about why I do that and why it matters to you. So, what exactly is a MIGS and why is it important to you? First of all, a minimally invasive GYN surgeon is somebody who specializes in doing very complex, non-cancerous, benign GYN surgery through very small incisions. So the main way we are minimally invasive is through the size of our incisions. But as you'll hear as I talk with you, there are a whole lot of other things that we do to make surgery less disruptive for your life. And so we're minimally invasive on a whole lot of levels. I practice in San Antonio, Texas, and I specialize in robotics as a form of minimally invasive GYN surgery, but I have some really amazing colleagues who don't do robotics. They actually do what we call straight stick, or the original kind of laparoscopy, and they are also very, very fine minimally invasive GYN surgeons. And there are now fellowships that are popping up actually quite extensively for GYN, OBGYN residents who want to specialize in minimally invasive GYN surgery after they complete their 4 years of OBGYN training. So right now, there are several different board-certified specialties, subspecialties in OBGYN. They include the older 3 subspecialties, which are GYN oncology, minimally invasive MFM, which is maternal fetal medicine, or the OB experts, and reproductive endocrinology and infertility. Then there's also urogynecology or pelvic floor subspecialty, and there's also a pediatric and adolescents subspecialty. But the one that interests me the most and the one I'm going to chat with you about today is MIGS, minimally invasive GYN surgery. And I'm going to give you a little bit of an idea why that is important to you and what the amazing things that we are doing these days and increasing the ease of surgery for women and what the standard of care is and where it's going in the next couple of years, because we are right on that frontier, baby. So much fun. All right, so I want to tell you a little bit about the characteristics of advanced MIGS surgical teams, because I'm not the only one by a long shot. There are lots of us across the United States, but all of us that practice in this subspecialty share some very simple commonalities. So I kind of want to share them with you so you can know what to look for when you're looking for a minimally invasive GYN surgery for yourself or your loved ones. So first of all, we usually have very, very minimal blood loss. It's unusual for us to need to do a transfusion during a surgery. And the way that we do our surgeries is very clean and efficient, with usually losing less than 25 or 50 cc's of blood, which is less than you would get if you just went to the doctor and had a lab draw. Our conversion rates are generally less than 1%, or our open surgical rates. That means that almost everything we do is through small incisions. And usually the biggest incision that I do is about an inch, sometimes a little bit bigger than that when we're dealing with really, really large fibroids or uteruses. But the other thing about a minimally invasive GYN surgeon is it's rare for us to take a case and start it out through small incision surgery and need to convert it to an open surgery, but that happens sometimes. We also have very low complication rates. Now, no surgeon has a zero complication rate. That's just not possible when dealing with the human body. Like, the unpredictability of being human is part of what makes surgery so much fun. I always say surgery is like Christmas. You never know exactly what you're going to get until you get in there. And then knowing what to do and figuring that out once you're in there is the joy and the art of being a surgeon. I really love that part. But all of us that practice these high volume robotic or minimally invasive GYN surgeries, the more we hone our craft and the more efficient and capable we become, the lower our risk of injury becomes, from injury to internal organs or infection or bleeding or having something go wrong with the case. It's just a matter of putting in so many more hours than we're able to do when I was doing general OB/GYN. Our teams tend to be very fast and precise in the OR. We really increase our efficiencies. I hold the unofficial world record for the fastest robotic hysterectomy time. Not that speed is the only thing, but speed is something that happens naturally as a result of the surgical procedures becoming integrated into your subconscious and working on the efficiencies with your team. And so that's something that happens when you see these advanced MIGS teams. They become very fast and very efficient. We have very fast turnovers in most days. Most of our cases are same-day surgery, which is really fun. That's something that really got emphasized during COVID when hospitals had bed shortages. And now hospitals have kind of picked up on that and decided that being able to move patients to outpatient surgery rather than keeping them in the hospital is a good thing. For my patients, this is one of the things that I think of as being minimally invasive to their lives. So for them to be able to go home to their own bed, take their own medicines, be with their family, eat their own food, not be waking up every couple of hours with vital signs or, other hospital stuff going on. If it's not necessary for them, I find that my patients do a whole lot better at home. They're more likely to get up and move around, which decreases the risk of complications from DVTs or blood clots in the legs. And most of my patients do really, really great at home, especially with some of the newer advances in pain control that we have. Speaking of pain control, we as MIGS surgeons usually minimize narcotic use. So my narcotic prescription rate is super, super low. It's not zero because there are patients that have special needs and tolerances, and we certainly want people to be adequately medicated. But it is very, very common for us to do non-narcotic surgery. And the way that we do that is with a numbing medicine called Exparel. And yes, I have been a speaker for Pacira in the past. I'm not currently sponsored by them for this talk. I just think that this product has been an innovation and a revolution in how women experience surgery. So I love talking about it. So Exparel is a numbing medicine that we use as a local anesthetic in the incisions, sometimes as a nerve block. And what it does is it time releases itself over a couple of days, usually 3 to 5 days, depending on your metabolism. And with that base, we're able to treat most of our patients surgically with non-steroidal pain medicines and Tylenol rather than having to reach for narcotics. And that is just a breakthrough, especially in these times when we're really concerned about overdose and narcotic usage rates in our country. So not only is that a good thing for the rest of the country, but it's also great for patients because being on narcotics is not the most fun thing in the world. You have, side effects from that, and more about that later. Most of us also have very high patient satisfaction rates. It's not uncommon for my patients to come into the office and say, hey, that wasn't as bad as I thought it was going to be. And I always tell them I kind of live for that. That's what I hope for everybody. Sometimes I get the, oh my gosh, I had no pain at all. And it was great in 3 days. Your results may vary. There's also the patients that need more time and healing and don't heal up that fast. So I don't want to slant things the wrong way. But the patient satisfaction rate with minimally invasive surgery is very, very high, often because they've heard stories from their mothers and their grandmothers and their friends about what to expect from surgery. And then when we're able to over-deliver on those expectations by getting them feeling better faster and making surgery easier for them, well, of course, patient satisfaction is a great thing. In fact, most of the time we can get our patients back to a normal desk job and normal activities within, I usually say 7 to 12 days. I like my patients to take a week and a half off from work. I think our bodies need to heal, and we as women do so much and don't take care of ourselves enough. So can you get back faster? Yes. Should you get back faster? Sometimes no, probably not. So I mentioned the MIGS thing. I think that was pretty funny. Top Gun was one of my favorite movies growing up, and Maverick came out a couple years ago, and, Tom Cruise is in the fighter jet at the beginning of the original movie, and he's like looking at the MIGS upside down, shooting the picture. So I'm not that kind of MIGS. Obviously, I'm a minimally invasive GYN surgeon, but I wanted to go over a couple of characteristics of how surgeons, what things we have in common with fighter pilots. This is kind of a fun list. So here you go. 1, we do intense life-risking work. 2, we play with very, very expensive equipment. My robot equipment costs over $1 million per robot, and that's not even figuring in the equipment of everything that I use with it and all the staff and the ORs that had to get built out and all that. So yeah, we deal with very expensive equipment, and I'm very grateful to my Intuitive and HCA partners. There's not a legally binding thing. It's more in a loose, like my collaborators between Intuitive Surgical and HCA. I'm very grateful for the collaborators that have helped me build my practice and that I'm continuing to work with in building out our next future. Both being a fighter pilot and being a surgeon are learned skill sets. So I like to think of surgery much like a musician learning a musical instrument. In fact, the equivalence between watching a young surgeon start their surgical path and seeing a more mature surgeon have the confidence in their surgical path, and then seeing surgeons become the maestros or the experts in surgery, that's really a really fun thing to do. And the skill evolution is very similar. So much so that when Intuitive Surgical, who tracks our hand motions on the robot, they can look at patterns of hand motions from surgeons across different parts of the United States, and they can actually see dialects. They can tell where we're from or who we were trained with by the way our hands move. And I just think that's fascinating and such a cool correlation between music as a skill set and maybe fighter pilots too, and being a surgeon. And that's part of why I named my practice Virtuosa GYN. It's the feminized version of being a virtuosa, which is a excellent musician. That's how the practice came to be named that. It's what I strive for every day. Both surgeons and Top Gun fighter pilots use intuition and how we feel things by touch. They both come into play where our technology stops. So we're both operating highly technical instruments, but we're using our personal intuition and touch to integrate with that. And that's where AI leaves off, which is another upcoming topic in surgery. There's a lot of discussion about what the need for the surgeon is in the future and where AI blends into that integration between the technology and the surgeon. We both work in places where teamwork and trust are really, really integral to our mission. In my case, surgery. I have an incredible team, and nobody does this without a really, really great team. It's very, I liken it to any other great team, a rock band or a car assembly line or whatever you're doing. That's a team. This is not a solo business, and there are a lot of people with lots of varied skills and I have incredible talent and intelligence surrounding me, and I'm grateful to my teams every single day. Both fighter pilots and surgeons, we push the envelope on what is humanly possible with efficiency and data integration, and we are combining that with technology. And additionally, how we recover from the unexpected makes all of the difference. If you ever watched Tom Cruise in one of those movies, the Top Gun or the Maverick movie, about how he recovers when something doesn't go right? Well, newsflash, things don't always go as we plan in the operating room either. And one of the best things you can do if you're choosing a surgeon is know that you have somebody that knows how to take care of the complications when they happen, not just do the surgeries. So I like to joke with my patients and my residents. I teach residents from Brooke Army Medical Center now. They're really awesome. They come operate with me. I tell them that you can teach somebody to do all of the surgeries that a GYN needs to do in about a year's time, but the rest of your residency and then the 2 years of MIGS fellowship are about teaching you how to make the correct decisions about what to choose, how to do the surgery, and then how to handle the complications and things that don't go right. And the last thing that we have in common with the fighter pilots and the surgeons is not going to surprise you. We both are people with huge confidence, competence, arrogance, and sometimes humility. So we always strive for that humility, but that arrogance and that confidence is something that we also have to be able to do the jobs that we do at the level that we do. And I think that's kind of funny. So I wanted to talk with you a little bit about the robotics itself. Like, what does that look like? I have patients who come in and they say, is the robot doing the surgery? And that is absolutely not true. Robotics is actually an advanced form of laparoscopy or small incision surgery that I started doing. I hate to tell you this, like it's been almost 33 years since I started doing laparoscopy. I was really well trained at the dawn of the laparoscopy era. And what the robotics movement has done is allowed me to attach technology to the laparoscopic instruments so that I sit at a terminal that looks more like a video game terminal than at bedside where we do straight stick laparoscopy. This has lots of benefits for me as a surgeon as far as saving my body from the stress and strain of being a surgeon and wearing down. But the coolest thing is that the visuals and the haptics and how I work with the joysticks and the foot pedals, it all integrates and it makes surgery more fluid, and I can do a whole lot. I've got wristed action instead of just straight stick, and it makes me able to do extremely complex dissections for patients much faster than I would if I was doing it straight stick. So what kind of procedures do I actually do? Well, by far, my most common procedure is hysterectomy. And we do those for lots of different reasons, but the most common reasons are women that have really heavy bleeding or fibroids or have pelvic pain or have uterine prolapse. That means that things are falling down. And my second most common procedures would be myomectomy, which are where we take out fibroids, which are tumors that are non-cancerous that grow in uteruses and they cause a lot of pain and bleeding. And then the third most common thing I do is endometriosis, and probably the fourth most common robotic surgery I do is something called sacrocolpopexy, which is the only surgery in which I still use mesh, but that is basically putting in a ligament replacement, like you would have a joint replacement, like a knee replacement. Well, when women's insides fall down because their collagen is weak and there's no more connective tissue to connect to, we put in a mesh that suspends their organs up to the inside of their body, and that's called a sacrocolpopexy, and that's done robotically. So the other thing that's really cool about robotics is I mentioned that we can handle really complex procedures. Well, what makes something a complex procedure? Well, one is medical complexity. So I'm used to handling patients that have all kinds of very complex medical problems. And oftentimes GYN surgeons or OBGYNs who don't want to deal with those levels of complication will refer those patients to me to take care of because it's what I do all the time. But some other things that increase the complexity of our cases are really large uterus or having fibroids, depending on how big they are or the size. They can be very complicated cases. Very obese patients. San Antonio is the third heaviest city in the United States, a fact that I am both proud and appalled of. What we've seen as a GYN surgeon is that the obesity rates have also paralleled not only diabetes rates, but they also parallel the rise in estrogen-related GYN problems like fibroids and endometriosis, making this one of the best places in the country for me to practice as a minimally invasive GYN surgeon that takes care of women with those problems. Also, if a woman's had prior surgeries, they're often complicated by having prior adhesions or if they've been pregnant and had C-sections. Some patients have endometriosis, which is a condition that can deeply infiltrate their pelvic organs. Even though it's not cancerous, it can be very difficult surgery because of how it invades the internal organs. All of these things increase the complexity of cases and make seeking out a minimally invasive GYN surgeon something that you should probably think of. So, I mentioned a little while ago that we're coming up on the 10th anniversary. Oh, I didn't mention that. By the way, we're coming up on the 10th anniversary of Virtuosa GYN, the practice that I founded on May 1st, 2014. This practice was founded as South and Central Texas's first dedicated MIGS practice. And so we've been making surgery easier for women for a decade, and that's coming up this week. That's why I'm taping this for you this week. So I just wanted to give a little shout out for a little practice, and the little train that thought it could. I think I can. What was the little train? That was a little story I read growing up. Thought I could. It's really rewarding to me to see how far my team in the OR has come, the advancements that have happened in the last 10 years, how my clinic staff, my office staff, who are amazing people, how that has come together, and how now more than 18,000 of you as my patients have come and let me have the honor of taking care of you. You've trusted me with your care. My friend was asking me the other day about how long I'd been practicing and how much I had done. And just to give you a little bit of background, I went to Texas A&M University, and I went there for both undergraduate and medical school. And I started my residency at Georgetown University in 1991 in OBGYN. So I started delivering babies and doing surgeries 33 years ago. And I was like 12 at the time. Oh my goodness. And I calculated by the time I quit doing OB, I had done several thousand deliveries. And some of those now I've got patients that have come back to see me and their kids are having kids. And that's incredible. It's amazing to see these grown up little people that I watched over in the womb, way back then. It's so cool when I get to see the follow-ups on those. It's like then the rest of the story. And we were talking about how many surgeries I've done. I've done almost 3,000 robotic surgeries in the last 15 years. So I started robotics in 2009, and I was one of the first 24 OBGYNs in the country trained at the highest level, which is the master's level. So, and plus all the other surgeries I had done before then, we came up with, like almost 15,000 surgeries, because I do about 700 surgeries a year now, 250 to 300 robotic surgeries, but then all of the other types of surgeries and procedures that I do too. And I thought that's an astonishing number, but I don't think it's that far off from having such a full, amazing career. And gosh, it's just incredible to me to think that I have seen the insides of so many women's abdomens. That's kind of funny. But just that I've had the tremendous privilege of taking care of so many of you. And so the next thing that's coming is we're planning on taking what we've done in the last 10 years, and I wanted to tell you a little bit more about what we're building and what's coming in the next 10 years for us. First of all, I am really proud to announce that I'm Intuitive Surgical's newest faculty member for the National Faculty for Teaching Benign GYN. This is a huge honor to me, and I'm the first woman that they've had on that team. And I'm extremely grateful and honored to start that. So I begin my faculty training next week. And so I'll be training other OBGYNs around the country how to do the procedures that I do. I've also been a speaker and proctor and observation site for Intuitive Surgical and Assessa for many years. And I've been a past speaker for Procera, as I mentioned before, but also Cooper Surgical. So those are my disclosures. So one of the things that I wanted to let you know about is we're in the process of building a new medical office and a new hospital outpatient department with Northeast Methodist in San Antonio, Texas. So our the new office for Virtuosa GYN is going from a 4,500 square foot office to a 6,000 square foot office. And right now we are 3 providers. It's myself and my 2 amazing nurse practitioners, Michelle Self and Tamara Kruger. And we are going to be expanding and hiring on 2 additional GYNs. So I'm bringing on an additional MIGS surgeon who I'll be introducing you to later this year. She is graduating from her MIGS fellowship, and we're excited about her joining us. And then I have another GYN, general GYN, who's been in practice almost as long as I have, who's going to be rounding out our team. So our new Virtuosa GYN office is going to be located on the 2nd floor above the new hospital outpatient surgery department that we're building next to Northeast Methodist Hospital. The surgery center has already been designated by Intuitive Surgical, who, for those of you that don't know, they are the creators of the Da Vinci robotic system. That's what I operate off of. But we've been designated as a epicenter. That's huge. An epicenter is a designation by Intuitive Surgical that means other surgeons are going to come and learn to do what we do. And our specific niche is to teach other surgeons how to increase their outpatient surgical rate and to increase their surgical skills. So once a surgeon is trained at a basic level of robotics, there's a real gap between their original training and in increasing their efficiency. There are not a lot of places for surgeons to learn that advanced skill set. And back when I was learning how to be a surgeon, when I was in early private practice, the system was a lot different. We almost always scrubbed with a senior partner. And so we improved our surgical skills because we were scrubbing with a senior partner. Now, due a lot to the decrease in reimbursement and the cost of private practice, most new surgeons coming out are either practicing by themselves or with a first assist, like Lacey Aguero, who's my incredible first surgical assist, or Ellen Diaz, my other incredible first surgical assist. So they help me on most of my cases. But they aren't capable of teaching a young surgeon how to get better surgically. So what we're building at this epicenter in San Antonio is a place for mentorship, where not only can surgeons come for case observation and get to see what we do and learn about our teams, or hire me as a proctor to go teach them in their ORs or oversee what they're doing, but they'll be able to come and do a mentoring visit, which means they could bring their cases there and have a mentor on site, since my office is going to be upstairs and I'm going to be doing surgery in the building most days. Having an on-site mentor is something that would decrease the amount of open conversions and be able to get more cases completed in a minimally invasive outpatient manner for their patients, which is better for patient care. And we're also working on setting up a program where they could come scrub with me for like a week. You can come be a resident for a week. So if you wanted to learn as a surgeon how I get big things out of small incisions, which that's one of my secrets I'm not going to tell today. If you want to learn how to do fibroid surgeries or advanced types of surgeries, there's a need for this mentorship type program where you could come and scrub with me for a week and learn those skills. I do, about 12 to 20. The goal is 20. I think I did 17 surgeries last week. So in a week, we can certainly get a lot of experience and have a great time just hanging out together and learning more. I always learn from people when they come and hang out with me too. It's a lot of fun. What else are we doing? We're building a new YouTube channel called Virtuosa Surgery. That's coming. And what that's going to be is similar to the Dr. Crockett Show channel, only it's going to be all about surgery. And so we're going to be presenting cases in the office setting. And then we'll also be showing the technical side of it. So if you wanted to actually see what it looks like when I'm operating, or if you're a surgeon and you want to increase your skills, we're going to have some special things coming from that perspective, also increasing the availability of teaching. Let's see, what else are we doing? We're getting some new robots in. I've played with the new DV5, which is the latest robotic system. That's really cool. We've got AI stuff coming in. And remote proctoring. I'll be able to start doing remote proctoring. Y'all, this is crazy. Like, I'll be able to have a surgeon that's remote who says, hey, I got a problem. I need for you to take a look at what's going on. And from my robotic system in San Antonio, I'll be able to remotely log into their system securely and help get them through whatever they're dealing with. I won't be able to handle the instruments, but I'll be able to give them instructions about what I see and how to think about what they're doing and their options at that moment. One of my favorite quotes of all time is this one that sits up on the wall up here. Y'all can't see it because it's behind the camera, but it's a Jack Walsh quote. His quote is that the hero is the one with the ideas. The hero's the one with the ideas. And everybody's all afraid of all this AI and what's going to happen to us. But what AI can't reproduce is the creativity and the ingenuity and the ideas that come from being human and wanting to serve and care for and take care of other human beings. That's the personal side, and that's never going away. That's a promise from me to you. So I look forward to the next 10 years of Virtuosa GYN and the evolution of minimally invasive surgery. Thank you for listening in today. Please make sure to drop your questions and comments below. And if you like this show, please share with others and like and subscribe. That's how we grow. And I'll catch you on next Tuesday. I'll see you then. Have a great week. Take care.